The next phase of Australia's coronavirus containment has begun. The Army has been called in to back up police to ensure thousands of returning travellers remain in lockdown in hotels across the country. They've been warned they'll be fined or jailed if they ignore the rules. There are now almost 4,000 cases of COVID-19 in Australia. The death toll has risen to 16. But there is some good news. The nation's rate of infection is slowing. Ursula Hager begins our coverage.
The latest line of defence against an enemy we can't see. The Army was deployed to our airports, police stationed outside city hotels. From midnight, everyone flying in was temperature checked, loaded onto buses and taken to enforced quarantine in a hotel.
Exhausted. It's been a long flight, but we're okay.
Are you ready to quarantine whole family in one room?
It's going to be interesting.
Family and friends were told by police not to greet them at the airport, that this is the new welcome home. But Andrew Cowling went anyway, worried about his 85-year-old father.
They've got dietary requirements, health requirements, and they're locking them up in a hotel rather than doing proper health screenings on arrival.
They will be looked after, they will be treated very fairly, but nevertheless be in isolation for 14 days.
But some are already being accused of breaching the rules.
The doctors should know better.
New South Wales police say 33 doctors who arrived on Friday night from Chile were deemed a high risk and told they too needed to quarantine at a nearby hotel. They're accused of breaching those orders to return to the domestic terminal. 6 were stopped there by the AFP. 27 others managed to get on flights across the country.
They did the wrong thing. That's my primary message. And law enforcement authorities will be following up those matters.
But 10 News First has spoken to a senior doctor involved who says the messages given by health authorities at the airport that night weren't clear.
They should have known better, and I think they knew that they were being given orders that were being prepared by New South Wales health staff at 4:30 a.m.
All these tough measures are having an impact on the disease's spread. As the health minister tentatively put it,
positive early signs of flattening of the curve.
This is what he means. Since our 50th case was recorded, the infection rate here had sharply increased. But with the ban on gatherings and non-essential businesses closed, it is now showing early signs of slowing. And the federal government is promising more help for Australians in dealing with the virus that won't require you to leave your home. Instead, they'll come to you through your phone. A WhatsApp group has been created to help people find out where to get support, while a new coronavirus app will provide the latest health advice.
That's providing further information, more resources, a trusted place of advice and information that you and your family and your business can use.
Connecting the isolated, another weapon in a war we need to win. Ursula Hager for 10 News First.
And Kimberly Pratt is live outside the Novotel, one of the hotels being used to quarantine airport arrivals in Sydney. Kimberly, any word on how people inside are coping?
Chris, the ones we've spoken to that got off planes today, well, frankly, they are just happy to be in Australia. But there are those that we understand who have been in hotel isolation for several days that aren't happy with conditions. Many say they feel like they're being treated like prisoners with no fresh air and no home comforts. More concerningly, some have raised concerns online that they're not getting access to appropriate meals and necessary medication, which are definitely issues in this time where we're all trying to stay as healthy as possible. But the Police Commissioner did respond to these concerns today, saying that he understands that it's not an ideal situation at the moment, but he wanted to remind these people that they are in a hotel and that they are on home soil. And after the Ruby Princess debacle, these are necessary measures to keep Australians safe. Chris.
Thanks, Kim. Kimberly Pratt there. As we go to air, the Prime Minister is hosting the latest round of crisis talks with state and territory leaders. The National Cabinet is assessing the current restrictions to control the spread of coronavirus and discussing possible new financial subsidies. Today, the federal government announced a $1.1 billion health package to support some of the most vulnerable Australians.
It's not getting any easier.
As each day unfolds, there are more challenges to address.
And today, the Prime Minister was focused on helping the millions of Australians struggling to deal with the worsening crisis.
For right now, it's about getting more support to people in the community that need it most, and that's their health care, that's their mental health, that's their protection for vulnerable Australians.
A $1.1 billion package.
We need to put more resources into supporting people who will be vulnerable.
New money and more measures which will be rolled out immediately.
$74 million for mental health to support for domestic violence initiatives.
Home is not always safe. If only it could be.
As the nation deals with hundreds of thousands of job losses and collapsing businesses.
Anxiety, the possibility of depression, loneliness, isolation, the need for access to services, all of these are real.
Support services have seen a sudden spike in demand.
We're also putting $200 million into emergency relief support. That will be provided to support charities and other community organisations which provide emergency food relief.
But most of the package, nearly $670 million, will go towards expanding Medicare subsidies to allow patients to see health professionals from their home by video conference.
What these services will mean is that every Australian anywhere can get the help that they need.
For people who are on concession cards and for children under the age of 16 and for people who meet the vulnerable categories will continue to be bulk billed using telehealth.
The federal government is also scrambling to fix a gap in the welfare system before payments start being delivered in April. As it stands now, hundreds of thousands of people who have lost their jobs would miss out on Centrelink benefits.
Even with the significant ramping up of capacity through Centrelink and other government services, that was fairly quickly overwhelmed.
More income support could also form part of the government's third economic stimulus package.
It's very clear that a wage subsidy is vital if we're going to minimise the impact.
Details of that package are expected to be announced this week. Amber Austin-Wright for 10 News First.
And our political editor Peter Van Onselen joins me now. Pete,